be doing a yoga for back pain practice, and this is going to be a therapeutic approach practice to helping any kind of lower back issues or sciatica type issues or piriformis, anything to do with the pelvis, lower back area. And what can happen is you can start to actually, if you've got sensations up in your upper back like your shoulders or your neck, often it comes from something happening in your pelvis, and even your feet, but we're not going to get there today. So looking at the pelvis can help not just your lower back, but it can also actually help release things going on in your upper neck and your back as well. So we're actually going to get started right away on your back, but before you go onto your back, make sure you have some supplies with you. So you're going to see, maybe you can see, maybe not, but I have a chair, and there's going to be a dog, and a blanket, and a couple bolsters, which we're going to pull out. So if you don't have a bolster, just folding up a pillow does the trick quite nicely. So go ahead and start on your back, and we'll get started about what kind of session this is going to be. So I'm going to get Cynthia to go down to her back. So set yourself up on your back where you have a bolster under your knees. And let your legs straighten out over the bolster. If that's a bit intense, then I'm going to show you a resting posture that's a modification. So you can have your legs bent, yeah, and then drop your knees together. So either one, whichever one feels better in your lower back. So I'm going to give Cynthia back the bolster again so that she can rest comfortably. So a key part of helping with lower back pain is the relaxation component. So that's why I want to start there. If at any time in your practice today you feel like you've done too much or your back starts to get achy, I want you to come back into this resting posture. And even if this is where you stay for the duration of the session, that's a beautiful practice. So in our session today, we're going to look at 4 ways to help lower back pain. The first way is relaxation and breath work. The second, we're going to do alignment. So we're going to do some I'm going to show you some ways to do some self-assessment and some alignment work. The third way is we want to start to strengthen. So we want to strengthen things like our inner thighs, which is a part of our core, as well as our deeper core muscles called the transverse abdominis, your TA. From there, we're going to do some decompression work, some nice gentle stretching, and some ways to create some space, some length in the body, which is going to hopefully feel really, really good. So while you're lying on your back, start to connect with your breath. Hands can be on your belly if you like, or out to the sides. Okay, that's enough. And just start to slow your breath down. What happens when we experience quite a bit of stress in our body is that the stress hormone cortisol tightens up the muscle tissues. And for some people, those muscle tissues could be the muscles across the back, the neck perhaps. They tighten them. And that's important if you're trying to fight or flight. You're trying to get away from a situation or fight a situation. But then we need to remind those muscles how to let go. Especially if you're not actually in a stressful situation anymore. You need to learn how to let go of that tension. And this is really the beauty of a yoga practice. So take a few more breaths here, and then start to see if you can lengthen your exhale. By lengthening your exhale, you're actually triggering the parasympathetic, the relaxation response in the body. So without forcing it, just consider your exhale and let it be a little bit longer and a little bit deeper. You might find as you're laying still, your mind gets a little bit busy, and that's okay. The mind always likes to have a story. Just Just be aware of that inner dialogue, but see if you can bring your awareness back into your breathing. Focus on the long, smooth exhale. Okay, then from here we're going to move into a breathing technique, one that's a really great one to release built up tension. This is something you can do throughout your day, but in particular before yoga practice, and it's called the ha breath. So basically at the end of the exhale, you're going to release your jaw, you're going to just separate the top and bottom teeth, and as if you're saying the word ha, and just let a sigh out. So we'll do it together. Take a nice big breath in, and then we'll do it 2 more times. Inhale, ha-fa, and then a soft ha breath out. And then you can repeat the ha breath as often as you need, maybe through the practice. And then when you feel that sense of calmness or ease come back in, move your breath again in and out through your nose. So from here, we're going to start to do our assessments. So you want to keep your breath smooth and steady. And at any time you're finding, again, that your body is just a little bit achy and you like to rest, come back into this position, your resting position, your initial position. So to begin with, what I'm going to do is check Cynthia's alignment in her pelvis. So there's 3 things I'm going to look for. One is whether one hip sits higher than the other, and I'm going to show you how you can do this for yourself. So what we want to do is make sure to bring that hip back and level. The second thing is a rotation from the pelvis, a tilt, either an anterior tilt where you've got this big arch in the back, or a posterior tilt where it's flattened out. So we're going to try and level that. The third one is a rotation, either the right swinging forward or the left swinging forward. And so we're going to help balance that as well. So these 3 different ways that the pelvis can move out of alignment. We're going to show you how to get your pelvis back into alignment. So to start off with, what I'm going to do is I'm going to pick up Cynthia's legs, and I'm going to assess whether one leg is longer than the other. I'll do a little assessment with the dogs in the way as well. Alright, so I'm going to take the bolster out. Thank you. And what I'm going to do is I'm going to lift Cynthia's legs up so that I can give her a little bit of traction. Her hips can just level out on the ground. This makes it a little bit trickier with the dogs in the way. So this is okay though, because I can still assess what's going on here in her legs. So what I'm looking for is I've got my thumbs on the inside of her ankle bone. So I'm going to show you here, just on the inside, I've got my thumbs there. I'm going to give her a little bit of traction, where I'm just drawing back slightly, and I'm going to bring her legs together. And her ankles are lining up, which means that her pelvis is level, meaning one hip isn't sitting higher than the other. One way you can do this on your own, which I'm going to get Cynthia to do now, is she's going to lift her legs up on her own, which maybe isn't as awesome as if someone else is doing it for you, but go ahead and lift it up. And she's just going to basically eyeball the insides of both of her ankle bones. And she can kind of just see from there that they're fairly lined up, so she can even bring them together. You can lift them up a little more to get a good look. Okay? And then lower them back down. Now, from here, what we're going to want to do is to, if you do happen to have one leg that's longer than the other, we want to balance that out. So to do that, I'm going to actually get you to slowly come up to standing. And this is where you're going to want to use a step or a block There we go. So come on back over to the block facing the camera. Great. And step on the block with your left leg. And let your right leg balance or hang. Good. So what you want to do is if you at home have a step, you're going to want to step on it. And let your shorter leg be the one that hangs down. If both sides are balanced, you want to do this on both legs. So what Cynthia's going to do, she's just going to let her right leg balance, hang down. And ideally she's got a wall or some support to balance her and not dogs her and knock her over. And from here, what we want to do is we want to remind the muscles in her back that remind the muscles in her back body how to let go again. So what I'm going to ask her to do is to hike up her left hip as high up as she can. Hike it up, or excuse me, your right hip. There we go, thank you. Hike up her right hip and hold it for 5 seconds. 1, 2, 3, 4, 5, and release slowly. Good, 2 more times. Hike up the leg. And release it. And last one, hike it up. And nice and slowly release it down. Good. And then from here, just let the legs swing a little bit forward and back. And then add a little internal rotation to the leg as you're swinging. That's it. Good. And then just let the leg hang a little bit more so that it's not, you can just release it as you swing it and helping to release through all the muscles in the back body. And what we're doing here is helping to release the QL, the quadratus lumborum, which is one that tends to be quite tight, pulling the hip up to the rib. So thank you. And then let your leg hang. And then step your feet off the block and pause on the floor for a moment. And just if you can, close your eyes or soften your gaze and tune into the sensations you're feeling through your leg, through the back body. Then we're going to repeat it on the other side. So from here, stepping over to the other side, right leg on the block, left leg down. Because Cynthia had her hips balanced, she's going to do both sides. But for you at home, if you have one side that's shorter, make that the leg that you're hanging off. Until you get balance, and then you can do both sides. So she's going to start off with the 3 times hiking her leg up, lifting it up and holding it for 5 seconds as a way to remind that QL, that quadratus lumborum, how to engage and therefore how to relax. Good, nice. That was a good one. And again, lift it up. Good. So really engaging the muscle here and then releasing it nice and slowly. Good. And last one. And release. Good. And then let it swing and sway. And just imagine it like a pendulum. Good little internal rotation. Nice. And then nice and slowly step off the block. Close your eyes down, pause there. And just notice how you're feeling through your back. Good. Take a big breath in and a ha breath it out.